Hi, my name is Dr. Kunal Bandare.
I am Dr. Karan Sunyanarayan.
So today we're going to be discussing an article which came into a newspapers,
Yeah.
and it was dated on November 7th. And the article really said that a child died after root canal surgery. Okay, so Dr. Karan, you can say more on this.
So the first thing when I read this article, the first thing that came to my mind was
भाई साहब कुछ ज्यादा नहीं हो गया ये? मतलब कुछ भी
because root canal treatment generally is a very safe treatment and it is nearly impossible, very close to impossible, I would say, for a person to die during a root canal surgery. Yeah, there are times when, due to complications that happen due to negligence of the patient, that they don't get a root canal done on time, due to which the infections increases and spreads so much into the other bodily spaces that sometimes it gets inflamed under the tongue and the tongue falls back onto the throat and their breathing is obstructed. This condition is known as Ludwig's angina.
Yes.
In that condition, that is the only time that it can
Be life-threatening.
be life-threatening or fatal and still correctable. But usually during the procedure or after the procedure, it is nearly impossible for, or it doesn't even ever happen or never has happened that any patient will, die after the root canal surgery. So the news article that has been put up over here is actually framed very wrongly. They have said that the Kerala child dies after root canal surgery.
Yes.
So that is not the case. In the
That really cannot be the case.
Yeah.
We are really sorry for the loss of that child.
Yeah, we are very sorry for that, but this is not the case. It has not happened because of the root canal.
It has not happened because of the root canal treatment, and it would never happen on this planet Earth. At least it would never happen
During the
that a person would die because they have got a root canal treatment done.
Yeah.
You would also see a lot of American videos they have made that you after doing root canal treatment, you the bacteria below the tooth, basically it goes to your heart and बहुत सारी आगे problems आपको हो जाती है. This is all false. वो उन लोग बैकग्राउंड म्यूजिक और शूटिंग बहुत ब्यूटीफुली करते हैं. उस
Netflix
वीडियो में
documentary
नेटफ्लिक्स डॉक्यूमेंट्री भी है उसके
हाँ,
ऊपर
निकलवा दिया है.
निकलवा दिया है.
So anyway, that is all wrong. Root canal treatment is a very safe procedure. Like I told you, it's only negligence which causes problems in a root canal treatment. Now, coming back to the case that we have in hand, Dr. Kunal will explain to you actually what happened.
Yes. So basically, this child was put under general anesthesia. Okay.
So, can you tell them why do you put a child?
Yes. So children at times are not that cooperative during the dental treatment.
Especially 3-4-year-olds.
3-4-year-olds, 5-6-year-olds. So for these kids, basically, we suggest our patients or their parents that we have to do this procedure under root canal under general anesthesia. एडवांटेज क्या हो जाता है जनरल एनेस्थीसिया का कि हम लोग ज़्यादा प्रोसीजर्स एक ही सिटिंग में फिनिश कर सकते हैं. बहुत सारे एक्सटेंसिव प्रोसीजर्स लाइक रूट कैनाल ट्रीटमेंट, कैपिंग, फिलिंग,
पूरा मुंह का जो भी काम है,
मुंह के अंदर जो
we do it for adults also. For big surgeries, but usually root canal procedures for adults are done. Even for most of the children are done under local anesthesia. But basic procedures I'm talking. The advanced now for certain age groups and in uncooperative adults and patients, especially when there is multiple work to be done in the mouth, during that time we suggest the patient to go for a general anesthesia. This means the patient is completely unconscious and we have control, so we can finish it quickly and do it precisely, because otherwise the patient will keep moving and not allow us to do the treatment properly. That is a very good way and it is done very regularly. I have done so many surgeries under general anesthesia, like for implants. Zygoma implants and all we do many times under general anesthesia. So that is also a very safe procedure. But in this case particularly, the problem that happened is that the patient did not inform about their past medical history to the anesthetist and the dentist. So there are certain conditions where general anesthesia is contradicted or can be dangerous. So that patient either themselves did not know properly what conditions they were going through, and secondly they did not inform about the symptoms that they were having. Like the child was having seizures दौरा पड़ता है ना वैसे हो रहा था और he had that problem plus उसका speech clear नहीं था, he was having so that indicates some problem in the central nervous system. In those cases general anesthesia is generally contraindicated or they have specific way of handling it.
Yes.
So that was not informed to the treating doctors. That is the biggest problem that has happened, where the patient has not informed, even though the doctors have done all the pre-operative tests and investigations that have been required. That the article doesn't mention any of it.
Yes.
It is just talking about root canal surgery causing and the child woke up. From where did he wake up? So that is the main thing. The child was in general anesthesia. He was awakened after procedure. He was checked for 2-3 hours. Everything was okay. This what happened was a sudden cardiac arrest, sudden fall in vitals. So that is the reason why the patient has passed away. It is not because of the procedure. It is not because of the general anesthesia. It is because of lack of information sharing with the doctors. Many times patients are very apprehensive about telling their medical history.
Yes.
I myself have one patient who has diabetes. And she comes for implants. I do regular implants in her mouth, but she never checks her diabetes because she keeps telling me if I check my diabetes and it's high, you will not do the implant for me. So, and there are many people who don't check. They know they have diabetes, but they don't check it. And suddenly, before any procedure, when we check it, you will see the parameters are way above normal. And then we ask them to get it under control. So the main problem over here in this case that has happened is that it is the lack of information sharing with the doctor.
Yes.
Don't hide your medical history from your doctor. Be very clear about it. And even the doctors should, I think we generally take all the history before doing such procedures, especially delicate ones. So so we stand very solidly with the doctors who are here. And 100% it is not their fault.
Yes. But again, I would like to put light again on the article. The writer, the editor, they are just writing
media
left, right,
houses.
and
You all
center.
need to really tighten your socks. You all are writing nonsense. You are writing absolutely baseless things without doing any research. This is bullshit. You don't even I think this is to get the TRP, like one of the groups में जिसके सनसनी create करने के लिए, to create that कि भाई और रूट कैनाल से पेशेंट मर गया. ऐसा पुणे में भी हुआ था लास्ट.
पुणे में भी हुआ था कुछ 5-6 साल पहले. एंड वहाँ पर से कुछ डॉक्टर्स मुझे ऐसे रिपोर्ट करते थे कि हाँ यहाँ पर रूट कैनाल ट्रीटमेंट बच्चों में तो या जो भी इसको कुछ और रूट कैनाल ट्रीटमेंट नहीं बुलाया जाता है, कुछ और बुलाया जाता है. पल्पेक्टोमी बुलाया जाता है. पल्पेक्टोमी तो हमारे यहाँ पे पेशेंट्स मानते ही नहीं है.
बच्चों में करवाना तो बच्चा पेन में रहेगा जिंदगी में. मैं समझा नहीं जब तक उसका दांत निकलता नहीं है.
एंड इसी तरीके का आर्टिकल, वन साइडेड आर्टिकल भी उस टाइम पे आया था कि रूट कैनाल प्रोसीजर करवाया और बच्चा वाज लाइक नो मोर. ऐसे एक आर्टिकल पहले भी
most of the times is root canal procedures that have done are not done under local anesthesia. And most of the times in our practices when we do root canal procedures, it is under local anesthesia. And this general anesthesia thing is again, like I want to specify, it is because of patient hiding history. Or undetected causes. It has nothing to do with the daily procedures that we do every day. So yeah, and media outlets, what you pointed out was very right. Continuously you are badgering and writing wrong things without knowing the whole information about the case. I would urge all our our governing bodies to please give out a statement clarifying all these things, because there are a lot of misconceptions that are going around in the mind of people. People come and ask us whether this is true, whether this is false. People who have undergone root canal 10 or 15 times. So this is completely unethical. It is wrong.
Already speaking, already the patient is already scared, tense about
any basic procedure.
या कुछ भी फिलिंग भी कराना है तो मुझे इंजेक्शन लगेगा एंड ऑल दिस थिंग जो भी है तो बेसिक मैंने बता दिया. बट इससे भी ज्यादा भी बहुत लोगों में डर रहता है.
आदमी को आप और डरा रहे हैं. आपका काम नहीं है. यू हैव टू रिपोर्ट फैक्ट्स, यू हैव टू रिपोर्ट द ट्रूथ.
एंड ऑल्सो ये आर्टिकल्स आने के बाद कभी भी फॉलो अप आर्टिकल्स कभी
आते ही नहीं है. कभी नहीं आते
कि हाँ
अपॉलॉजी आता है. क्योंकि हर बार ये हुआ है कि हर बार ये लोग गलत प्रूव हुए हैं. Because of सब investigation होता है, it is always proved. So these media outlets are always wrong. So you don't give any follow-up articles. You do not apologize to the doctor whom you are slandering. So I would just urge you all to please report facts. That's all I would
At
like to
least
say.
this time they haven't mentioned the names
Name
of the doctors.
नहीं तो वो भी करते
Thank you very much for that.
हैं। वो भी किया होगा कोई न्यूज़पेपर।
इसके पहले किया था ना?
नहीं अभी भी
पुणे के
ये भी
case में
केस का कोई और न्यूज़पेपर में किया होगा इन्होंने। So
हाँ,
please,
yes.
you please be aware, and I urge again all our governing bodies to please give out statements against these media houses who are spreading completely wrong information, wrong rumors, and please stand solidly with our fraternity. And what is wrong, what is right. We have been making videos for in the past which we have made, which are against the wrong things that are happening in our fraternity. So it is not that we are just blindly supporting anything, but where it is wrong, it is wrong. So I think you should everyone should tighten their socks, and for the general public, root canal is a very safe procedure. Local anesthesia, general anesthesia is usually very safe, and provided you keep your history information and everything that you give us, you give it in the right manner and not just for the sake of it.
Yes, correct.
That's all I would like to say in closing.
Yes, we'll conclude this video like this. Thank you.
Thank you for watching, and please do like, share, and subscribe.
Yes, see you again.